Record. Here we go. Hi everyone, my name is Terry Cochran. I'm Director of Alumni Relations here at Brock, and also Brock graduated in '97 with Communication Studies. So I'm going to be co-hosting the session, or playing MC as Dr. Lara begins her presentation. But before we get started, just a few kind of homecoming pieces. And we're glad to see people from across the world, we can actually say. But I'd like to start with a land acknowledgement here for Brock University. I think it's appropriate as we approach National Truth and Reconciliation Day next week. But just like to acknowledge that Brock University acknowledges the land in which we gather is traditional territory of the Haudenosaunee and Anishinaabes people, many of whom continue to live and work here today. This territory is covered by the Upper Canada Treaties and is within the land protected by the Dish with One Spoon Wampum Agreement. Today, this gathering place is home to many First Nations, Métis, and Inuit peoples, and acknowledging reminds us that our great standard of living is related to the resources and friendship of Indigenous people. Of course, we encourage all of you to look into the lands in which you reside and learn more about them and the people that have come before us. So going on from there, I'll just mention that we are recording, but all of our homecoming sessions will be available after the fact. So I know there's two kind of running consecutively now. You had a big decision to make, but they'll be available in the hub after that homecoming hub when you logged in. So you can go back there. And we encourage you to leave questions in the chat. So you can send them to everyone, you can send them to me, and I'll moderate the chat and bring them to Anna so that she can focus on presenting. With that, I'd like to introduce our guest speaker here today, and we're very fortunate to be joined by Dr. Anna Lara, who's been involved with the health industry for over 20 years. She got her BA in biochem here at Brock, and has further pursued her education as a naturopathic doctor from the Canadian College of Naturopathic Medicine in Toronto. Anna's greatest passions are learning and teaching, which has led her to study some of the most renowned doctors of natural medicine in the world. She empowers her patients to understand their health and is a regular presenter for the Brock University Med Plus program. We're honored to have her here today. So with that, I'll pass it over to you, Anna.
Thank you so much, Terry, and thank you everybody for joining. It's awesome to see that there are people really through so many different. We moved on, obviously, from St. Catharines. I have to say that there's nothing as I don't know. It feels warm always to connect with people from Brock. It's almost like home. And I graduated in 2000 with my biochemistry degree, and I was by then pretty sure I wanted to pursue naturopathic medicine. So it was a great jump board for me to go there. And I have to say that biochemistry, I pretty much got close to 100%. So some good preparation from Brock. And we are here to talk about something that I encounter pretty much on a regular basis. I wanted to talk to you guys today about inflammation. And the reason that I thought it would be a great subject to cover is because I find right now a lot of us are obviously under more distress, and due to circumstances, I think more aware about our well-being and our health. And what I find is whenever we get sick with anything, really, whether it's an infection, if there's already an area where we're suffering inflammation at, then it gets aggravated. And so without any further getting into it, I want to share my screen with you guys so you can see the presentation I've prepped for you. All right. And as Terry mentioned, if you do have questions, I think you'll be able to look at those as you can add them to the chat, and then we'll have some room at the end to go over everything. All right. So inflammation it is a healing mechanism that we've developed. It's something that our body basically does to respond to any kind of offensive threat, whether it's trauma, whether it's a virus, whether it's bacterial or something chemical that we get exposed to. The immune system is going to respond by mounting an inflammatory process. And so we want to have this mechanism working for us. It is extremely efficient. And what I find, sorry, for some reason it skipped. What I want to define for you is once inflammation is triggered, we have the response, especially of our circulatory system and our white blood cells going to an area and responding. So I'm giving you some background. So by the time that we dive in a little bit further, things are going to make sense. So what is the initial response of something that creates inflammation or initiates the inflammatory response?
Sorry to interrupt, Anna.
Go ahead.
There's been a couple messages of people who are having difficulty hearing. I'm just wondering if you might. I'm hearing you okay, but just wondering if you might be able to speak up a little bit.
Oh, sure. Sure. Yeah. Is this better? If there's anything, please interrupt me, okay? I am a bit of a soft talker.
Okay.
So when we start with something that has injured us, there's always going to be the initiation of redness to an area. And the redness is created by the increase in blood flow to an area. We'll get swelling by the same process. And plasma is the clear fluid in our blood that begins to also gather and respond to a threat or something that has invaded our system. And the heat that we also tend to feel with inflammation has to do with also the increase in circulation to the site. And pain can be due to either the trauma that caused the inflammation, but also by the swelling and all the release of proteins that are going to get our system responding. So, it is a wonderful, wonderful response. And there are two types of inflammation. The first one we have is the acute. It's a short-lived form. It usually is something that if we cut our fingers, we wash the wound, we put a Band-Aid, and we don't have to think about it happening. It happens on its own, and it reaches an end usually within days. So whether it's an infection, whether it's a cut or a wound, it heals on its own, and you don't really have to do much to intervene. When something is more chronic, it's something that has not been resolving on its own. There's an inflammation that gets usually triggered more likely due to toxins or chemicals and things that we come into everyday exposure to. So for example, people who smoke, or if we are constantly in a laboratory setting, we're going to be exposed to some chemicals despite, fantastic ventilation. Or hairdressers, I tend to see a lot of hairdressers with allergies as well because of a constant amount of chemicals. So that's when things become longer standing. They don't tend to recover by themselves, and it can be lasting months, years, or even an entire lifetime. Now, why is this really a problem? What I want you to become aware of is that, yes, under normal circumstances, our body is able to recognize, okay, I need to just stop the process and healing has happened. And that's the normal healthy immune response. But when it gets stuck and it's on continuous play mode, there's something then that begins to cause more reactions. There's usually an overreaction that happens with the immune system, and that can lead to allergies, or then lead to further conditions and further tissue breakdown. So as we get progressively worse with chronic inflammation, then we get the development of specific diseases. And we can see the type of diseases such as cancer, cardiovascular, Alzheimer's, pulmonary, arthritis, autoimmune conditions, neurological conditions, and diabetes. So I want to share with you a case of a patient that came in, and JS is a 42-year-old female. She is 5'10". She weighs about 328 pounds, presented with irregular blood work. and her doctor was very concerned, wanting to rule out cancer. She reported feeling pain in various places, fatigue, palpitations, unusual periods. She would report sometimes getting more frequent periods or sometimes missing periods, sometimes severe heaviness, sometimes not at all. Hair loss, difficulty moving, irregularity in the bowel movements, and occasional rashes throughout her body. When I took the case, I also did an physical, and on observation, JS had high blood pressure, not super high, but about 141/92, a reddened complexion, and very dry and irritated skin, chapped lips, dry hair, and her breathing seemed agitated. Fluid retention, I noticed on her, especially lower legs and her feet. And when we looked at her blood work, she had had quite a bit of blood work. Her white blood cells were elevated, her cholesterol. She had elevated blood sugar, irregular red blood cells, an increase in IgA, which is an inflammatory marker they test for. And they were also doing a specific protein electrophoresis. And this is just basically something that they use to rule out chronic lymphocytic leukemia. So this is what the doctor was afraid she was also dealing with. And on the ultrasounds, she had cysts on both her right and left breasts and fatty infiltration of the liver. Already had the diagnosis of arthritis on her right knee and plantar fasciitis. And if you don't know what plantar fasciitis is, it's a very painful reaction that people have at the bottom of their feet that they notice, especially in the morning. When getting out of bed, it hurts to put their feet down on the floor. And it feels like you just wish you could walk on your toes because any pressure is going to be causing pain. And then as you continue throughout the day, moving a little bit more, it gets easier. But that's a classic picture of plantar fasciitis. So if I were to ask you guys what you think JS's possible diagnosis is, they were looking, her doctors were looking at a few different things. We could consider thyroid disease, or especially hypothyroidism, so low functioning thyroid. And that could be because of the dry skin, the hair, her lips being overweight. That could definitely point to thyroid disease. We could consider heart disease, such as, because of the high blood pressure, the high cholesterol, fatty infiltration of the liver, palpitations, diabetes because of her high blood sugar, being overweight, and also the fatty infiltration of the liver is something that tends to go hand in hand also with diabetes. And definitely hormonal imbalance because of her fatigue, her unusual periods. Palpitations tend to happen with hormonal imbalance, and also having cysts on both her breasts. So those are some possible diagnoses, I should say. And really at the end, is it all of the above that she's dealing with? So really, in reality, she is dealing with pretty much all of that. And the common thread to all of these is chronic inflammation. So I like to describe to my patients that chronic inflammation, when it's that advanced, it's as if their body's responding as if they felt that they're on fire from the inside out. So there's constant dis-ease. They're not at ease in their body. So then, where do we start? The conventional approach really, most of the time, is using something to calm down the inflammatory symptoms. And so we'll use NSAIDs such as ibuprofen, naproxen, and aspirin at times can be used. That's not an NSAID, of course. There are steroids that do get prescribed, prednisone, puffers if there's allergic or asthmatic reactions, and injections can be used as well for joints. You can get a cortisone injection, which can be very helpful. People often have digestive issues, so they will use acid blockers such as Prevacid, Tecta, omeprazole. I mean, there's a number of them really. So at times these are life-saving. And what we're looking for is really to help our patients to live and function. And the symptoms can be so severe that they get in the way of everyday life. So they need something that's going to give them the solution and the ability to get through and cope. And the only issue that I have when depending on these on a regular basis, that doesn't stop the actual inflammatory process. All the time, it can. For example, I've had patients who get a cortisone injection for their shoulder or for their knee, and it seems to resolve the issue. So at times there can be intervention that will bring about complete relief and healing and reset the system back to acute rather than chronic inflammation. So how we handle these over time for me is something that's going to influence our overall state of health. Going back to our sample case with JS, she, with her doctor, had already been taking Tylenol and Advil on a regular basis. She had a history of being on birth control for a number of years before she started trying to start a family. It took some time for her to get pregnant with her son. And she was told she needed to lose weight, and they were going to put her on blood sugar medication. They were in the process of doing that. She was getting referred to a specialist, and she was referred to 3 different ones at the time. So my role in all of this is, at the end of the day, to figure out, one, what my patients are needing, and working with them and their medical doctors. That's my favorite part, in bringing about the changes that they want to bring to their health. So from a naturopathic standpoint, we're looking at all the different possibilities of helping to calm down inflammation and begin to heal the system. And it is a multi-systemic approach. So that can include diet, it can include specific supplements, it can include definitely stress management, movement, sleep hygiene, and I'll explain all of these as I continue along, but I just want you to keep in mind the approach that I want to begin to really explain to you is how these are so useful, but definitely using multi-systemic is really key here. And then we can get specific treatments. So when we look at dietary approaches, this is usually what I use with patients. There are anti-inflammatory diets. There's also looking at my patients and trying to figure out if they do have a food intolerance. And then we can begin to work on repair for their digestive system. We help to support the increase of elimination of toxins. I will get into discussing water, because I think that a lot of the times that can be extremely helpful, and avoiding sugar, especially high fructose corn syrup. So I'm going to get specific now in the dietary approaches by first discussing the anti-inflammatory diet with you. So what does the anti-inflammatory diet look like? There are so many different versions of it. And what I want to summarize for you guys is that overall, it's a high intake of antioxidants and polyphenols. And what these help to do is to bring about specific steps in the inflammatory cascade. I thought it would be too technical to include the diagram for you guys, but there are specific areas where the polyphenols from fruits and vegetables, the fibers, the antioxidants begin to stop a lot of the production of some of the pain-producing cytokines. So berries, think of color. Anytime that you look at fruits and vegetables, the more colorful, and if you can eat them, and they're not just a simple starch, then the more helpful they are with inflammation. So that can include, I included the list for you just to have an idea of what that tends to look like. And most patients happily begin to follow this if there are no specific restrictions they need to have. And I am happy to say that dark chocolate can be a part of this if you are a chocolate lover. And then when you pay attention to the anti-inflammatory diet, I want to emphasize that we also have some foods that have been researched. Whether you are allergic to them or not, they tend to create more inflammatory cytokines as well. And so they do so at different levels for different people, but more important than not, these are foods that I get my patients who have a lot of inflammation altogether to avoid. So again, that's the list of wheat, corn, flour, some dairy products, commercial eggs versus organic eggs can make a difference. A lot of red meat or a lot of pork. And I do emphasize a lot because some in moderate levels can be okay. Refined sugars is a big one. High fructose corn syrup. I really try to have every single patient avoid, regardless of whether they have inflammation or not. Peanuts have a specific reaction that are very pro-inflammatory. And I have a number of patients who absolutely love their peanut butter and would have it for breakfast and maybe even lunch if they could. So that's a big change for a lot of patients. Tomato, especially when it's off season. I know we are right now in tomato, we're finishing tomato season for a lot of us. And when they are ripened and fresh, they're less offending than when they are actually green or ripened in a greenhouse and off season. And potatoes, that's something that I've noticed also for some people, creating inflammation. They're not as always as severe, the reactions to potato. Fruit juice and citrus fruits. And when I say citrus fruits, it does not include lemon or lime. It's more focused on oranges and sometimes grapefruit. Fruit juice because it's a concentrated sugar. Processed foods. So think of how much we have in our grocery carts when we go to the grocery store that's processed versus fresh. Fried foods, and that's just because of the type of fats that they have that also increase the inflammatory reaction. Hydrogenated oils, alcohol, and caffeine. And when we look at the digestive system, one of the things that I like to figure out with patients is if they have any specific food reactions or intolerances. And when we eat those foods that are difficult for us to break down, especially, we don't have enough enzymes, or we're not producing enough hydrochloric acid in our stomach to break things down, or there's already a poor diet in place that's perpetual, really, for a lot of us, depending on time, that's a lot of restraint that people describe to me in terms of why they don't have enough time to prepare the food they would like to. Then there can be damage to, I'm going to say it in quotations, yes, our gut. And that can lead to further intolerances and more reactions to more foods. And I have an example, that top diagram of what different types of colitis there are. On the left is what a healthy colon should look. In the middle is ulcerative colitis, which, as you can see, is there are specific wounds already in the colon that can bleed. And on the very far right is what Crohn's disease can look like. And in there's not necessarily any bleeding, but there's definitely pain and inflammation, and people will have bouts of it. And all these can have times when they are very severe, or they can be obviously just a little bit calmer, right? And I included this diagram for you of what the gut lining tends to look like. On the left, we have a nice and healthy sample of cells in the stomach lining. If you see them, there's good tight junctions between them. They're lined up relatively smoothly, and there's a lot of control of what goes in through those cell membranes and what goes out. And on the right, when there's been a lot of inflammation or inflammatory reactions due to eating foods that are more difficult to break down, and for proteins that are or cytokines that are actually causing damage, then we begin to see that tight junction get broken down, and there are more gaps. And then we see introduction of things that don't necessarily go through a cell membrane, but can go in those gaps and trigger further allergies. And people begin to become more symptomatic. And so that's just to give you a little bit of a visual of what both healthy lining looks like, and then one that's already reacting to a chronic inflammation. So what would I do when people are already, following an anti-inflammatory diet, and we are helping them to control their inflammation? I begin to, one, get them to avoid drinking a lot of water or liquids with their meals, because a lot of the time I find people tend to over drink with their meals, and it's almost like they take a bite and they take a sip. They take a bite, they take a couple sips, and they can go through 2 or 3 glasses of water while they're eating. The reason this is not good is because you're going to be diluting your gastric juices. Your stomach works so hard at producing all these gastric juices, enough hydrochloric acid to begin to break down food, and then we go and dilute it by drinking a lot of water. So this is a very controversial topic because a lot of people feel the need to drink a lot of water so they can be fuller while they're eating and they don't tend to overeat. But when it comes to digestion, you're compromising your digestion when you do that. So I really work with people bringing down the level of fluids with their meals and drinking an hour after meal as much as they would like. Chew your food thoroughly. I know it sounds probably redundant for me to be discussing this, but you'd be surprised how much, whether you're eating at your desk, whether we are eating in between meetings, there's this tendency for us to just almost mini chew and swallow our food in chunks rather than the way we normally would be swallowing it if it was well chewed. And if need be, I'll use digestive enzymes, which would help to break down fats and proteins and carbs. And glutamine, and I apologize, I see there's an extra L on the glutamine. Glutamine is an amino acid that we get from really most proteins that we have. So whether they're animal proteins, whether it's a specific protein that we take if we are wanting to add a protein powder into our lifestyle, it is extremely supportive of that tissue that I showed you in the previous picture. So it does help to repair some of that inflammation that's going on, and the tight junctions respond much better. So that's glutamine. And bone broth is very rich in glutamine, which is why a lot of people feel better when they tend to have it. Fiber. So fiber, for me, you can add it if you add flax seeds to your diet, or whether you have enough vegetables and fruits in your diet. So those are things that I use on a very regular basis. Next, we have the increase of elimination of toxins. And what does that look like? Really, I just make sure that liver function is optimal, that kidney function is optimal, and bowel function is optimal. So when I look at liver function, I do look a lot at blood work. Same as kidney function, we can use blood work and urinalysis. And people tend to report at first that they tend to pee more frequently when they're drinking more water, but I will discuss that after. But we are supporting everything that needs to be removed from the body that is water soluble. Liver function is involved more in the chemical reactions. So if our hormones need to be processed, it would be happening through the liver. There's specific reactions that break down estrogen and progesterone and testosterone, and they support removing that. Cholesterol gets also broken down beginning at the liver. So you can see why liver and kidney function are so key. And then when I say optimized bowel function, is because there's a number of people who I find suffer from poor bowel habits. And what does that mean? It means usually they can be having a bowel movement every day, but those bowel movements can look like rock pellets or just very short and very hardened pieces. Sorry to be so graphic, but it is a part of something that I do discuss with my patients, versus something that feels like they're voiding fully, better formed, and usually larger pieces. And sometimes I have patients who go every 2 days, every 3 days, every 4 days. I think the longest I had was somebody who had a bowel movement every 2 weeks, which you can imagine how uncomfortable that would be. So those are things that we need to look at when there's an accumulation of toxins. So now, water. Water, as we know, obviously is essential for our body to function. We can function more without food than we can without water. And what I find is we often do mistake our hunger triggers, the hunger pang that we sometimes feel, can be mistaken for thirst. So I tell people, especially if it's away, in between meals, if they've had a good breakfast and if they're going to be eating lunch, I usually tell them, like, check to see first if what you're experiencing is thirst and not hunger. And so a lot of the time that will take care of that feeling. And that doesn't mean that you need to be ingesting significant volumes of water. The average way we look at this, especially when treating inflammation, is you take a person's body weight. So I have an example here of somebody who's about 140 pounds. You divide that by 2, and that gives you 70, and you turn into ounces, right? So that's about the quantity that they suggest for helping decrease inflammation. That's about 2.07 liters. So really, it isn't that much water when you think about it. It sounds a lot when you look at it in liters, because 2.07 liters, I don't know, for a lot of my patients, they give me a blank stare and it can be a little bit overwhelming to get through, but it's about 4 small water bottles, if you want to look at it that way. And I tell most of my patients, do you want to have grapes or do you want to have raisins as yourselves, right? Like, you want things to be as optimal as possible. And when somebody is accumulating a lot of inflammation and they have an increase of these toxins, then you can imagine that you want to also be helping them remove those, and water will help to do that. Herbal teas and non-caffeinated or non-sweetened drinks are also counted towards a patient's water intake. Sugar, this is a big one, big one. We are so responsive to sugar in our brain. It is, I think most of you may have heard, it is more addictive than crack in the response. The centers that light up in our brain are even more lit up with sugar than they are with cocaine, which is kind of crazy. So sugar itself is not terrible. It's the overconsumption of sugar that I really want to emphasize. And we just tend to look for taste, and we tend to look for things that momentarily, seem so satisfying, but we begin to lose our sensitivity to sweetness over time if we tend to have a lot of sugar in our diet. When we don't rely on a lot of sugar, then that sensitivity is heightened and we'll be able to taste things even better. So there are so many foods and many drinks that we wouldn't even imagine sometimes have sugar added to them, but they do. High fructose corn syrup is added to a lot of candy, a lot of gummies. I see a lot of vitamins in gummy form and supplements in gummy form. And I try to tell my patients, avoid the ones that have high fructose corn syrup. My issue with high fructose corn syrup is in the brain, it does have an impact in slowing down the reaction in our hypothalamus to feeling full. So we tend to overeat a lot of the time. So that to me is something we want to avoid, aside from the fact it contributes to fatty liver as well. Enriched alcohol, before I get into enriched flour, alcohol is another source of hidden sugars, right? By the way our body breaks it down, we convert it to different sugars and ethanol, and that can be quite harmful for our body. And most people who have inflammation and they have a bout of drinking, they went out, met friends and had a few drinks, then they will report the next day feeling a lot of joint pain or discomfort if they already have joint inflammation. So it's pretty simple to explain to them why then it's important to avoid alcohol. Enriched flour or white flour, those two, the reason that I have them here under the sugar group is because by the way our body breaks it down and incorporates it and we take energy from it, it is essentially just a very quick food that gets changed into sugar. So it tends to contribute to blood sugar levels as well, even though people don't think of it like that because it's not a sugar per se. Juices, again, that's a concentrated form of sugar. It doesn't mean that some juice is terrible for you, but just if you're having, let's say, a tall glass of juice, that's probably about 1.5 cups, and that would be roughly about 37 grams of sugar. That's a lot of sugar, and especially when we look at what the World Health Organization initiated as guidelines in 2015, they brought it down to having sugar make up only about 5 to 10% of our daily caloric intake, which is not much, to be honest with you. I think they ideally want to make it around 80 to 100 grams a day. So if you're already having in a tall glass of juice about 37, sometimes 40 grams of sugar, you can imagine there's little room to play with, right? Now, this is a question. Yeah.
We've had a question going back
Absolutely.
to the water.
Yes.
There's a question about how long after a meal should they wait to have water?
That's an awesome question. Ideally, if we're looking at food, it should be an hour ideally after eating. The minimum should be about 45 minutes, ideally about an hour after eating a meal. And if you want to know how long before eating, you should decrease your water intake about half an hour before eating. Thanks, Terry. Looking at the specific supplements that help to reduce inflammation, I'm gonna discuss the ones, there's a long list, to be honest with you. There's so many that I was trying to just give you the most often used and the ones that are also have the most concrete research behind them. But the list can be quite broad. I just always like to be evidence-based. So that's me, that's the biochemical background in me. So omega-3 fatty acids, which are high on both icosapentaenoic acid, otherwise known as EPA, or docosahexaenoic acid, which is DHA. Vitamin D3, please don't ask me to pronounce those again. I will just say EPA and DHA, which is what I usually call them. Vitamin D3, alpha lipoic acid, curcumin, and resveratrol. Those are the ones that I wanted to showcase for you guys today. So when we look at omega-3 fatty acids, these are definitely the most helpful fats. And what the sources where we can find these are usually in fish oils. We can find them, well, including especially sardine, which not everybody likes to eat, but they're very rich in omega-3 fatty acids. Walnuts, we can find them in some eggs that have been used or fed with flax seeds, hence that have eaten flax seeds. Flax seeds also have them. And we can find other fatty acids in other foods, but when we're talking EPA and DHA in particular, the best source is usually fish or squid as well. Those are fantastic. Krill, herring, salmon, cod. Those are the richest sources. So what effects can omega-3 fatty acids have? They are fats that can actually improve our insulin sensitivity. So that would be really helpful in somebody who has blood sugar issues or diabetes. Usually what happens is people begin to lose their insulin sensitivity and they have sugar sitting longer in their bloodstream, which leads to more organ damage. And so this is where omega-3 fatty acids would be very helpful. They help to lower cholesterol, especially by lowering triglyceride level and also increasing HDL, which are the high density lipoproteins. And these are more the heart, I'm going to say in quotations, protective type of cholesterol lipoproteins versus the low density lipoproteins, which are the more related to atherosclerosis and higher risk of stroke and cardiovascular disease. So you can see where if anybody has cholesterol issues, there would be, and I know I'm really generalizing without getting specifically into whether a person's on specific medications. I will discuss that after. We also help to reduce inflammation because of the reduction of blood clots that can happen and also risk of heart attacks. Fish oils can improve nerve function and can prevent the nerve damage that is often found with diabetes. So again, as I was saying, when insulin sensitivity is lost, we have blood sugar sitting longer around tissues we don't want them to be around. Now, I think I did nerd out and I included a diagram here for you of what those fatty acids can look like. But I wanted to give you at least just one study that I really like between EPA and DHA. For those people who are already taking an omega-3 supplement, I think it is important to look at the content of EPA and DHA and how high those are. Sometimes when people go and purchase them in a pharmacy, I'm going to say, as opposed to a health food store, we're comparing apples and oranges just because sometimes a minimum omega-3 supplement can have maybe 100 milligrams of EPA and 100 milligrams of DHA. at those dosages, really, we're not getting the effect that we're looking for. To get the effect that most studies are done at, we're looking usually at a minimum of between 500 to 800 milligrams 3 times a day is what they tend to do in studies. So just to kind of give you an idea, if you are taking a supplement, look for things that are at least starting at about 1,000, and that can be both EPA and DHA, or 1,000 EPA and 1,000 DHA would be phenomenal. Those are usually in liquid form, but if you're looking in capsule form, they tend to be obviously a little lower because you can't fit as much liquid in one capsule. So this study that I do share with you is that they found the benefit of both EPA and DHA, but they were surprised about how much DHA was supportive more at times than EPA. And I tend to use them similarly in the sense that EPA has always had the reputation of helping more with inflammation, and not as much DHA, but we're discovering the more we study these that DHA has quite a stronger benefit. And the role of EPA is that it helps to balance the pro and anti-inflammatory proteins. So it tends to reduce a lot more symptoms because it gets the system to go into pause and not get stuck on play. So remember that about EPA. And DHA has a lot of benefit in lowering specific inflammatory markers. So this is where, like I said, trying to find something that is balanced in both EPA and DHA would be helpful. And I think that's about as much as I wanted to share with you about this study. Next, I wanted to talk to you about vitamin D3. So vitamin D3, here's a diagram of where it can be found. It is actually a hormone-like vitamin. It is fat soluble, and it does impact or absorption of zinc, calcium, iron, magnesium, and all of these, interestingly enough, help to bring down histamine. So for people who have a lot of allergic reactions, vitamin D3 is something that is helpful. Usually I tend to suggest somewhere between, I give amounts later on, but somewhere between 2,500, at minimum 2,000 IUs of vitamin D is helpful. Our immune cells have vitamin D receptors, and these then help to control and protect us from developing autoimmune conditions. And there is a lot of research, and we're talking, it is amazing how much research has come out over the years in its involvement with supporting and decreasing the inflammatory process of MS. And this is why if we don't have a high enough vitamin D3 level, there's also a higher risk or susceptibility of people developing that condition. So that's vitamin D3. And next, I want to talk about alpha lipoic acid. And alpha lipoic acid is usually found in, we get that mostly through supplement form. It's not really found in a natural state in specific fruits and vegetables. ALA helps to reduce chronic inflammation by one, reducing the excess insulin. Again, if you think of that I described in especially patients who have blood sugar issues, there is, it reduces that excess insulin. And so we don't want to develop insulin resistance. We're always looking to avoid that. And it also counteracts, it's a fantastic antioxidant. So the oxidative stress that inflammation causes, as you're seeing in that diagram, is something that can destroy a cell or make it really sick. And ALA helps to reduce that and counteract it. So this is why it's so helpful, especially with people who have chronic inflammation going on. Curcumin, this is one that it has been around for a long time. There's always continuous research coming up. There's conflictive research, I will say, if people have specific conditions where it doesn't seem to have as much of an effect. But overall, curcumin is the active component of turmeric in the spice. And somewhere between 500 milligrams to 1 gram of turmeric is actually helpful with people who have diabetes or heart disease, inflammatory bowel disease, rheumatoid arthritis, osteoarthritis, and even cancer. So those are the most numerous bodies of research and focus that they have for curcumin. And one thing I will say about curcumin is it is something that responds better when there is fat if you're ingesting it. It's not something that we absorb very easily with just water. So a lot of people combine it with a little bit of coconut oil. If you've ever heard of golden milk formula, they usually add curcumin, some coconut milk, sometimes ginger and honey, which is a nice anti-inflammatory drink to have. But keep in mind that water is not necessarily the best way to drive this into our cells. And the last of the anti-inflammatory supplements that I want to discuss with you is resveratrol. Resveratrol is a fantastic, fantastic antioxidant. So it tends to look into most tissues and help to scavenge all those free radicals that are being formed while there's inflammation happening. So foods that are very rich in resveratrol are foods that are deep and dark in color. So blueberries, blackberries, dark grapes, and think of purple, right? Tend to be red wine even. And yes, peanuts. So I just wanted to give you full info. There is some resveratrol found in peanuts, but don't forget that there is a pro-inflammatory effect from just peanuts, especially the oils found in peanuts. Resveratrol has been shown to play a role in NRF2 pathways. NRF2 pathways are what helps to begin to put a stop to the ongoing, once chronic inflammation begins, I told you, it's almost like it gets stuck. NRF2 is a way that we can begin to put a stop to that. And NRF2 then is our defense mechanism that helps to reduce oxidative damage and cell damage. So those were all to do with diet and dietary supplements. Next, we can move to stress management. So the next few points I'm going to make are going to be a little bit briefer. I won't dive as much into them, but I'll be happy to discuss them if you guys have questions. So as you can imagine, anybody who is feeling unwell tends to develop also a specific level of distress. And so how do we counteract that? What do we do on a daily basis to try to manage that ongoing level of stress that we experience? And I work with people a lot by getting them to learn to breathe properly. And, you know, going back to the example with JS, I think that I mentioned that she had distressed breathing. It was always like rushed and not very deep. It was kind of shallow, but it was just the habit of breathing like that. It wasn't because she was experiencing her function of her lungs was compromised. It was more to do with just a way to also cope with pain. If you notice, most people change their breathing when they're experiencing a lot of pain. So breath is something that is so key. And I wanted to include this diagram because it just makes me think of something calm and to really take in a full breath. You're bringing it down into your diaphragm and low and filling your lungs. And the same as you're breathing out, you're releasing everything that you should be releasing that is not water and not chemically soluble, but more volatile, because we do also get rid of toxins that way. So that's just on breath alone. Stress management can be laughing, spending time with loved ones, having a pet. There's so many different ways that we can do stress management. I would even include meditation in this if you are inclined to do it. So just keep in mind, anything that helps to manage stress is going to help to decrease inflammation in the way that the brain and the body, or the mind and the body, are connected. So if there are questions, I'll be happy to discuss it further.
Hi, Anna. Sorry, Terry here.
Yes, absolutely.
We had a question back to the diet part about sugar. And is dextrose a good substitute to adding sugar to coffees and dessert?
Dextrose can at times be okay, because dextrose, well, just so you know, is usually a potato sourced sugar. And it's still, if overconsumed, going to be placing some stress in the liver. But it's not as much as if it was cane sugar. So if I try to substitute, I do tell people, I'm not crazy about it, but it doesn't have the same impact. Stevia is a little bit better. There's been conflicting research in terms of agave syrup. I find maple syrup and honey can be well tolerated, but if blood sugar is already an issue, then I would then go to either erythritol, stevia, monk fruit. That's a great one, and we are seeing fantastic actually results with that, and most people tend to like monk fruit, which is more readily available as well. So I hope that answers your question.
Thank you.
Thank you. So now obviously going to movement and exercise. The key thing here that I always want to emphasize is I've seen when we have pain, we tend to not want to move because it feels that when we move, we are triggering more pain. So we become more guarded, our posture even changes. So we get into this habit of not moving as much as what would be beneficial. Our body tends to get adjusted very easily to the lack of movement. And I've seen, especially with people who have arthritis, even their fingers can take on a different shape. I'm not talking about deviation to the side, but I'm talking about contraction in the palm and in the fingers as if they were holding a ball. I've seen also decrease in range of movement of the hips, of the knees, of the arms, right? It happens because there's often the inflammation going on causes often as well deposition of calcium in the area. And so we get some calcification slowing down the ability of us to have full range of that area. And without causing further injury, and this is why I do think it's helpful to have a physio or an osteotherapist guide you if need be, but movement is essential to also maintain the suppleness and the range of movement as much as possible. Almost, there's some research that's phenomenal as far as like, when we get to a place of discomfort, but we continue moving, there's been research showing, for example, even for arthritis, that we are stimulating chondrocytes and which create new collagen in the joint, which is astounding for somebody who has osteoarthritis, right? So if you don't use it, you lose it. I just want you to think of that. You need to try to move your body in whichever way you can. And maybe through that, you can get to a little more and a little more and a little more. So I tell people, just don't give up on movement because it is so essential. Sleep hygiene, I'm finally here. So sleep hygiene, the reason that I emphasize this so much is because most of us tend to have our pain or our inflammation or hormones disrupt our sleep. So I tell people to try to have routine. Getting up and going to bed at the same time is helpful, and our body begins to naturally get adjusted to that rhythm. I emphasize going to bed before midnight, every hour, and this is just a summary of a lot of research I'm going to give you. Every hour before midnight is actually more restorative than twice as much than after midnight. So the more early that sleep cycle starts, the better. The more early, that's incorrect. The earlier your sleep cycle starts, the better. Create a healthy sleep environment. So make your room as comfortable as you can. Whether you are in a space that you're not used to, if you're going back and forth or traveling back and forth, or whether you're in your home, just make it as comfortable as you can for yourself. Try to shut off your electronics. I tell people sometimes they don't know to have their sleep mode on, but also there's a light and or day and night shift, and the night shift just changes the light that's exposed. As most of you by now may have heard, blue light we get exposed to disrupts the production of melatonin, and melatonin is one of the hormones we produce that helps to sleep and stay asleep. So that's where electronics and watching TV and working with bright light is something you want to avoid before going to sleep. Avoid larger fatty meals before bed. The rule is usually about 3 hours, because what happens if you're eating before you go to bed is there's so much energy that's being driven to digestion that we're never going to prime our hormones to get to the level of repair and regeneration that we should while we're sleeping. Even if we are sleeping, there's not as much repair and regeneration. So people tend to experience more inflammation because of that. There's a picture of a woman doing a simple yoga pose, but it means relax. Try to get yourself into a more calm state before falling asleep. Exercise helps. I don't recommend vigorous exercise before bedtime, just because you don't want to be getting yourself energized. But I do know the impact of exercising during the day, improving sleep function and sleep being more restful. Limit how much caffeine you have. And for some people, it's limiting by the time of day and also the quantity. So if you're telling me you're having 1 cup of coffee or 2 cups of coffee a day, that is usually more acceptable. Then I know a lot of patients, I've had to get them to cut down from 6 or 8. So that's a big difference. Obviously, you know the effect of caffeine and sleep. And when people tell me, oh, caffeine doesn't affect me, it worries me, because then immediately it tells me that they're so not sensitized anymore to cortisol and the stress response. And what else? To go back to your patient, JS. So what I did with her, I started her on an anti-inflammatory diet from day one. I put her on a detoxification program for 30 days, which I usually don't do. I usually do 10 days, but for her, in this case, I did 30 days. I started an omega-3, giving her 1,000 milligrams of EPA and 1,000 milligrams of DHA. I put her on vitamin D3, and I did put her on 3,000 units a day. Her blood work had shown her to have a level of 35, which is actually quite deficient. I got her to increase her water intake because she was not drinking much water. She was usually drinking, she liked the water and juice. That was the habit she was into. And I suggested that she begin some light walking when she could, because again, the pain would at times get in the way with her feet, but she was gonna try to power through that. And I began to introduce the idea of intermittent fasting, which meant that for her, she stopped eating by 7 p.m. And I think she had her first meal by about 8 a.m. So all I wanted to do was her to not be snacking throughout the evening, because that was a habit she had as well. So after that, I was monitoring her, but 65 to 70 days after, her changes were quite significant. She had noticed her legs not having as much swelling, same as her fingers. She had been wearing a ring that she came in wearing a ring that she hadn't worn in a very long time. Her weight had gone down to 295 pounds. So it was about 3.2 pounds a week. I was a little bit worried because I don't like for people to lose too fast, too much weight too fast, because it's not sustainable. But with her, because she had so much fluid retention, I was okay with that pace. And she had noticed also more ease with movement. So she was getting more into the walking as much as she could. And after 9 months, she had also significant further weight reduction to 229 pounds. Her blood work showed her IgA level, and this was big, back to normal. That's one of the inflammatory markers that doctors check for in blood work. And they no longer had the concern of the chronic lymphocytic leukemia. She began to notice her hair not falling out as much, and her skin felt better hydrated. She described it as it feels healthy, and she had not experienced her rashes. Her breasts were smaller. They were still present, but they were just smaller to the point that she wasn't as symptomatic from them as well. But an ultrasound, they were, I think, like a 0.5 difference of a centimeter. And her HbA1c, this is the blood sugar level, had also decreased. So that's something that is possible when we begin to look at a patient holistically, right? And not just as one part apart from the other. So I always like to emphasize that. And lastly, specific treatments. So these are more specific for patients, and I will use them in specific cases when there's injury or when there's specific pain that they're feeling. I'll do acupuncture, I'll do cupping, I'll do homeopathy. There's a few different approaches that are more case by case based. And if there are questions, I'll be happy to answer them.
Anna, we had a question earlier on the chat about CBD oil and research around that. So if you're talking about specific treatments, maybe we can talk a little bit about that.
Absolutely. So there is some fantastic research actually coming up with CBD oil, especially in decreasing. At first, we're noticing just a decrease in pain, but it is having an impact in cytokines and prostaglandins. So these are the biggest drivers of inflammation. And when people are using CBD oil, we're noticing a decrease in both of these, especially those drivers. So this is something that I could probably do a whole talk on, but there is definite support from these. And some people find even their sleep also being more restorative when they're using it in the evening. So the amount is very specific. It varies, to be honest with you. There's nothing that I could say, oh, you only need to take 0.05. You know, the amount is very patient-centered. So hopefully that answers that question.
Thank you. And there was also a request to look at the anti-inflammatory diet slide one more time.
Oh, absolutely. Let me see. There you go.
Yeah, are there, just, I'm gonna turn my camera back on here. Thank you, Anna. Are there any other questions that folks might have for Dr. Lara?
I just had to ask a question about the CBD because it affects so many areas of the body, such as the endocannabinoid system, and affects mood and probably some mental areas, and as well as physical. So that's kind of why I asked the question. There's a bit more concern about that.
Thank you so much for that. So you're absolutely right. I think that's when I kind of touched upon the sleep aspect, but you're right. I've seen patients benefit quite a bit because the tendency for people to experience depression with inflammation, especially if there's pain, is very high. I think as high as between 50 to 60%. Most patients who've had chronic inflammation and pain will get into a depressive state. And I find that using something like CBD oil can begin to restore the feeling of, well, calm down because of the decreased inflammation, but also in the brain begin to balance out what we're getting triggered. Actually, inflammation in the brain begins to be more curtailed. And so there's a response of people having better stress management, less anxiety, or less depression. I'm going to say that in quotations as well, with the use of it. There's a more positive outlook, and it does seem to be quite conducive into the healing process rather than the continuing chronic inflammation process. Without getting into detail, does that answer your question?
Thank you.
Thank you.
Okay, thank you, Anna. I see it's just after 2 o'clock, which is our time. So just offer a huge thank you for the time and such an informative presentation. I'm sure we all learned something. There was a couple requests for the slides, and so maybe we can work together to get some information. I don't know how comfortable you are in sharing the actual slides or some of the information, but for sure we have recorded this as well, so that will always be available on the hub. If there's a particular section that you want to relive over and over and get all of this rich information to digest it, pun intended, that will be on the Homecoming Hub in perpetuity.
May I ask you a question at the end?
Yes.
Dr. Lara, I have a friend who is blind, and of course his life has been a little stressful after he lost his eyes. He is experiencing mucus in his defecation, and obviously he cannot see if there is blood, but I have the feeling, because I have seen the underwear sometimes with examples of blood. And I know that 10 years ago, he has a kind of polyp or something like a tumor. And I wonder, he said that the colonoscopy says that it was no cancer, no any concern about cancer. But I think at 60 years old man having this mucus frequently in his defecation, I don't think that is normal. I am not a doctor, but I think it's not normal to have mucus and not normal to have sometimes examples of blood there. With
Yes.
this pandemic, the family doctor doesn't advise any specific, any consultation with a specialist, but I told him you have to advocate by yourself because otherwise he can be developing something seriously harmful.
So that's a great observation. The things with mucus in the stool are usually due to the most frequent that we see, believe it or not, is with an irritable bowel disease. So it can be even irritable bowel syndrome, I'm going to say, but irritable bowel disease, and that would include something like a Crohn's, which would be more serious, and they should be able to find that in the colonoscopy. But more than likely, he has a chronic low-grade inflammatory disease. It's surprising that the colonoscopy, well, if the colonoscopy showed polyps, then there already is a chronic issue in the colon happening, right? And polyps can, over time, if left unchecked, become something, they can mutate into something more serious and then lead to more concern of colon cancer. However, mucus in the stool can be indicative. I find a lot of the time with people who have irritable bowel syndrome. So a lot of it can be due to the level of stress that they're experiencing. And if there's blood and there's bright blood, usually it's something to do with a hemorrhoid or a fissure, right? Rather than something that is higher up in the large intestine. So if they didn't find anything, I'm assuming from the colonoscopy, it would always be wise to be able to repeat it in the appropriate time. But I do find that we do have to be huge advocates for our well-being. Our doctors, especially right now, are overwhelmed and overburdened. And if we are not educated enough or empowered enough to, when we go on our visits, then there can be a lot of lost time and conditions can worsen.
Yeah, thank you.
You're welcome.
I have a question. If somebody wanted to book an appointment with you in the future, do we need a doctor referral or can we apply directly?
No, usually you can call directly. Doctor referrals are not necessary, even if you were to want to use if you have coverage, for example, and you wanted to have coverage for seeing a naturopathic doctor, you can just directly see a doctor.
Oh, wonderful. Thank you.
You're welcome. So thank you very much to everybody. Thank you, Terry, for helping me through this too, and being an awesome co-host. I hope that you guys are all well, and hopefully next time we can be together, it can be in person and not like this, right?
Thank you, Anna. I'm going to end recording right now here.